Hey everyone, welcome back to WellNexus, your trusted source for evidence-based health information. Did you know that over 40% of Americans are deficient in vitamin D? That's right, nearly half of us aren't getting enough of this crucial nutrient. If you're feeling constantly tired, getting sick often, or experiencing unexplained aches and pains, you might be one of them. Don't worry, you're not alone, and today I'm going to reveal 7 bizarre symptoms of vitamin D deficiency that most people completely miss. Stay tuned until the end for simple, practical solutions to boost your levels naturally and feel your absolute best again. Vitamin D isn't just any vitamin, it's actually a hormone that affects virtually every system in your body. Unlike other nutrients, we don't get much vitamin D from our diet. Instead, our bodies produce it naturally when our skin is exposed to sunlight. Unfortunately, modern indoor lifestyles, office work, northern climates, and even sunscreen use have created what many experts are calling a vitamin D crisis in America. The consequences of this deficiency can be far-reaching and devastating. Research published in the Journal of Pharmacology and Pharmacotherapeutics shows that insufficient vitamin D levels are linked to an increased risk of cardiovascular disease, cancer, autoimmune conditions, and even depression. What makes vitamin D deficiency particularly dangerous is that many people suffer for years without realizing what's causing their symptoms. While most of us know that vitamin D is important for bone health, the reality is that this powerful nutrient impacts everything from your immune function to your mood regulation. What's most concerning is that many doctors don't routinely check vitamin D levels, and the symptoms can be so unusual that they're often misdiagnosed as other conditions. Let's dive into these 7 bizarre symptoms that might be telling you your vitamin D tank is running on empty. Symptom number 1, excessive sweating, especially on your head. Have you noticed unexplained sweating, particularly on your forehead or scalp? This might sound strange, but excessive head sweating is actually a classic sign of vitamin D deficiency, especially in newborns and children. However, adults can experience this symptom too. According to research from the Cleveland Clinic, this happens because vitamin D plays a crucial role in your body's temperature regulation. When levels drop too low, your sweat glands can go into overdrive, particularly those on your scalp. Symptom number 2, frequent gum disease and dental problems. If you're struggling with bleeding gums, tooth decay, or frequent dental infections despite good oral hygiene, vitamin D might be the missing piece. A study published in the Journal of Periodontology found that people with higher vitamin D levels had a 20% lower risk of gingivitis. That's because vitamin D has powerful anti-inflammatory properties and helps your body absorb the calcium needed for strong teeth and jawbones. Without enough vitamin D, your mouth becomes more vulnerable to infection and inflammation. Symptom number 3, hair loss in unusual patterns. While some hair loss is normal, vitamin D deficiency can cause distinct patterns of thinning that aren't typical of genetic hair loss. Research published in Dermatology and Therapy shows that vitamin D receptors in hair follicles play a crucial role in the hair growth cycle. When these receptors don't get enough vitamin D, it can disrupt this cycle and lead to hair shedding or thinning, particularly in women. If you're noticing unusual patterns of hair loss, especially if it's accompanied by fatigue or muscle weakness, vitamin D deficiency could be the culprit. Symptom number 4, chronic lower back pain with no clear cause. Does your lower back hurt despite no injury or structural problems? According to a study in the British Medical Journal, up to 83% of patients with chronic lower back pain had inadequate vitamin D levels. This happens because vitamin D maintains bone health and supports muscle function. Without enough of it, the bones in your spine can soften and the supporting muscles can weaken, leading to persistent pain that doesn't respond to conventional treatments. Symptom number 5, slow wound healing. If you've noticed that cuts, scrapes, or surgical incisions are taking longer than usual to heal, your vitamin D levels might be low. Research from the University of Miami shows that vitamin D plays a critical role in the body's inflammatory response and the formation of new tissue during wound healing. In their study, patients with optimal vitamin D levels experienced significantly faster healing times compared to those who were deficient. Symptom number 6. Bone pain in your shins when pressing. Here's a quick self-test. Press firmly on your shin bones. Does it cause pain? This specific type of bone pain, called periosteal bone pain, is strongly associated with vitamin D deficiency. A study in the Journal of Clinical Endocrinology and Metabolism found that this symptom occurs because insufficient vitamin D causes the periosteum, the sensitive membrane covering your bones, to become inflamed. This can happen long before more serious bone problems like osteomalacia develop. Symptom number 7, muscle twitches and spasms, especially around your eyes. Those annoying eye twitches or muscle spasms that come out of nowhere, they could be signaling low vitamin D. According to research published in Neurology, vitamin D is essential for proper nerve and muscle function. When levels drop too low, the communication between your nerves and muscles becomes disrupted, leading to involuntary twitching, particularly around small muscles like those controlling your eyelids. Many people dismiss these twitches as stress-related, but they often improve dramatically when vitamin D levels are restored. Now that you understand these bizarre symptoms, let's talk about how to address vitamin D deficiency effectively. Here are 4 research-backed strategies you can implement starting today. Step 1. Get a proper blood test. Before supplementing, it's crucial to know your current levels. Ask your doctor for a 25-hydroxyvitamin D blood test, which is the most accurate measure of your vitamin D status. The Endocrine Society recommends maintaining levels between 30–60 ng/ml for optimal health. Knowing your specific numbers will help you create a targeted plan rather than guessing. Step 2. Strategic sun exposure. Your body can produce 10,000–25,000 IU of vitamin D in just 15–20 minutes of midday sun exposure with arms and legs uncovered, without sunscreen. For most people, getting 10–30 minutes of sunlight 2 to 3 times per week can significantly boost levels. However, this varies based on your skin tone, age, and location. Those with darker skin require more sun exposure to produce the same amount of vitamin D as someone with lighter skin. Step 3. Optimize your diet. While few foods naturally contain vitamin D, you can boost your intake by consuming wild-caught fatty fish like salmon and mackerel, about 1,000 IU per serving, egg yolks from pasture-raised chickens, about 40 IU each, mushrooms exposed to UV light, up to 400 IU per 3 Oz serving, fortified foods like certain milk products, orange juice, and cereals. Remember that diet alone usually isn't enough to correct a deficiency, but these foods can help maintain your levels once they're optimized. Step 4. Smart supplementation. For many Americans, especially during winter months, or for those who work indoors, supplementation is necessary. Research suggests that most adults need between 1,000 to 5,000 IU daily, depending on their current levels and risk factors. Look for vitamin D3, cholecalciferol, rather than D2, as it's more effective at raising blood levels. Also, take your supplement with a meal containing healthy fats, as vitamin D is fat-soluble and requires fat for optimal absorption. Addressing your vitamin D deficiency can truly be life-changing. Many of my clients report that within just 4 to 6 weeks of implementing these strategies, they experience significantly more energy throughout the day, stronger immune function with fewer colds and infections, relief from persistent aches and pains, improved mood and mental clarity, better sleep quality. What's amazing about vitamin D is that it works silently behind the scenes, supporting hundreds of biological processes in your body. When you restore optimal levels, you're not just fixing those bizarre symptoms we discussed. You're laying a foundation for comprehensive health that affects everything from your brain function to your immune system. Remember, vitamin D deficiency doesn't happen overnight, and neither does recovery. Be patient with your body and consistent with your approach. Small daily actions like a brief midday walk or a quality supplement taken regularly can yield profound results over time. The human body has an incredible capacity to heal when given the right tools. By addressing your vitamin D status, you're taking a powerful step toward feeling your absolute best and preventing serious health issues down the road. Our channel is dedicated to bringing you science-backed information to help you live a healthier, more energetic, and balanced life. We provide practical solutions to improve your diet, body, and mind, all in an easy and accessible way. Ready to take the next step toward a healthier life? Check out the recommended products that can support your journey. Find the links in the pinned comment. Subscribe now and turn on notifications to stay updated with the best tips on longevity, nutrition, and wellness. Let's transform our health together. Now, I'd love to hear from you. Have you experienced any of these bizarre symptoms? Drop a comment below sharing which one surprised you the most. If this information was helpful, please hit that like button and subscribe to WellNexus for more science-backed health content every week. Don't forget to tap the notification bell so you never miss our new uploads. Until next time, stay healthy and vitamin D-lightful.